Okay, let's talk now about periods and risk of pregnancy. This is Dr. Yost again. And as I mentioned in my introductory video, periods are not just something girls need to know about, but guys absolutely need to know about periods as well. The average age a girl gets her period is around age 12, but again, that is an average, so there's a lot of variation. Some girls get their period sooner than that. Other girls get their period a lot later than that. Most girls, however, about 95% of girls are having their period by age 15. Girls should get their period within a certain interval, although there is a lot of variation. 21 to 45 days apart is what is considered normal, and that's counting from the first day of one period to the first day of a next period. They should last 7 days or less, and you should use about 3 to 6 pads or tampons per day. If you don't really know what your cycles are doing, I would encourage you to write it down so you can see what the pattern of your cycles is on paper and kind of keep track of things. Here's an example of what is happening during the menstrual cycle. Again, it's a cycle, so it comes in a cyclic fashion, and the same thing kind of happens over and over again. Day 1 is the first day of your period. So the first day you start your period, that is day 1. After your period, your ovary starts making a little cyst. And again, this cyst is what is going to release an egg. And around day 14, which is about the halfway point in an average cycle, that egg is released. And that is the process known as ovulation. That egg hangs out for a while, and if no pregnancy occurs, then the lining of the uterus begins to shed, and you end up right back at the very beginning at day 1 with your menstrual cycle. There's a lot of other fun things that come with periods, and I'm being very sarcastic here, and that includes things like heavy bleeding, unpredictable bleeding, cramping, moodiness, like PMS, which is called premenstrual syndrome, and acne. Here's the good thing. There are a lot of benefits to using birth control. Less bleeding, predictable bleeding, less cramping, improved moods, and improved acne. So if you have trouble with your period, you may want to talk to your physician or your healthcare provider about the benefits of starting something for birth control, even if you're not sexually active. Many girls use birth control methods to help them have better lifestyles and less problems with their period. So there's not a medical reason that you have to have a period every month. So if I'm suppressing someone's periods with birth control, it is okay. So I want you to hear that, using one of these methods to just make your life better is completely fine. And keep in mind that all the methods that we talk about during Teen Talk are safe and reversible. Males are a part of the reproductive process, obviously. So as we just talked about anatomy, semen is the fluid that is released from the penis during ejaculation. About a teaspoon of semen is released, and that small teaspoon contains 300 million sperm. That sperm hangs out in the upper genital tract. So if a couple has unprotected sex, the sperm swims towards the cervix and it eventually makes it to the upper genital tract in the fallopian tubes. If a sperm comes in contact with an egg, a process known as fertilization, which is the picture on the left, that's the sperm kind of penetrating the egg and fertilizing it. That fertilized egg then comes down the fallopian tube and can be implanted into the wall of the uterus. And that implantation phase is where a pregnancy in the uterus starts. All birth control methods that we talk about during Teen Talk prevent the sperm and the egg from coming together. Some birth control methods are more effective than others. And again, the safest way not to get pregnant is to not have sex. But it's important to kind of know how your body works and to understand kind of the physiology of the menstrual cycle and know your risk of pregnancy.